A private clinic in BC called the Cambie Centre is challenging the constitutionality of the province's healthcare regulations. Now, the question is, should the government be able to stop people from spending their own money on a legal service which would solve a health problem or even save their life? Joining me now is Derek Fromm. He's a staff lawyer with the Canadian Constitution Foundation. Derek, welcome to Bridge City News.
Thank you very much.
Now, can you briefly share a bit with our audience some of the background of this case and with an update as to where we stand right now?
Sure. In 2016, the Canadian Constitution Foundation and Cambie Clinics went to court in BC at the Supreme Court, which is the lowest level of court there, and we started litigation against two provisions in BC law. And so what we anticipated as being 26 weeks of court time has now blossomed into 3 years. But there's a longer history. In fact, this litigation goes all the way back to 2009. And since then, the Cambie Clinic, the BC government, and other interested parties have been wrangling with these legal matters. And it only came to court in 2016, but just recently, in the last few weeks here, it's been starting to wrap up, and we anticipate that the government will be making their final arguments sometime around Christmas.
So essentially, we have a law that bars patients from paying for necessary medical care, which some see as a violation of their charter rights.
That's correct. So what we're challenging is two provisions in BC law. The first, as you mentioned, is a prohibition on private healthcare insurance. So this is the sort of healthcare insurance that people would be allowed to buy that would cover such things that the government already says it covers. So like a hip replacement, knee surgery, things like that the government system already purportedly covers. In BC law, you cannot buy health insurance for those types of procedures. Now, also, we are challenging a provision that says that doctors must enroll in either the public or the private system. They cannot have a dual practice in one and the other at the same time. They must choose between the two. Now, those two things together create a sort of problem in BC. It is not financially possible for doctors to have a purely private practice, and patients cannot afford to pay out of pocket for the sort of medical procedures that they might need.
You know, a lot of people would argue the fact that medical care needs to go to those who need it the most, not to someone who can pay the most. How do you respond to that?
Well, that's exactly right. And we would completely agree with that. And now, part of the thing that we're challenging in BC, one of the laws we're challenging, is the prohibition on private insurance. So currently, when someone who is very wealthy has a problem with their hip or has a heart condition and they are put in a government wait list, what ends up happening is they are able to afford to leave the country and get medical attention immediately. But somebody who does not have that sort of means is forced to wait, languish, and suffer and risk their health and risk death waiting for the medical treatment that they require. And with private insurance, that would go a long way to helping solve that sort of problem of equalizing the medical system and making it more equitable in BC.
You know what's interesting as well, Derek, is over the last 20 years or so, BC premiers have chosen not to enforce the laws prohibiting patients from getting diagnostic tests and surgeries from the private Cambie Clinic, and there doesn't seem to be any clear evidence that this has stopped regular people from getting health care?
Well, that's absolutely correct. And in fact, there's many people in BC that are able to queue jump and get right to the front of the list and seek medical care, including at Cambie. So for instance, if you're a member of the RCMP, or if you're a member of the armed forces, or you're a federal prisoner, you will get right to the front of the queue and you will get medical treatment right away. But it's those ordinary British Columbia residents, the children, the mothers, retired folks that don't have those sort of connections or that sort of the characteristics that allow them to queue jump like that. They're the ones that end up languishing and suffering and waiting in pain for medically necessary treatments in BC without being able to solve these sorts of problems on their own.
You know, I do understand that some people would feel discriminated against if someone with money, good cold hard cash, they can actually get surgery faster than they can. But how can we deny and justify that someone should continue to suffer if they're able to afford faster treatment?
Well, I don't think we should be forcing them to suffer, and that really is the crux of the case. See, this case is all about legalizing healthcare. No mother, no child, no retired person, no one in BC should be forced to wait on a healthcare wait list while their health deteriorates. They're risking their health, they're risking their death. waiting for medically necessary treatment in a BC public health care facility. And if this is something that the BC government simply can't provide to people in a fair and equitable fashion, in a timely fashion, then it must get out of the way. It must get out of the way so that patients and doctors can work together to solve these problems in a timely and fair fashion. Now, simply put, again, to reiterate this case is all about legalizing healthcare in BC, allowing patients and doctors to solve problems together. And if the government won't do this for BC residents, it's violating some of the most important constitutional rights that define us as Canadians, namely Section 7 of the Charter. Those rights including life, liberty, and security of the person. And with those at risk, the BC government, I think, is risking a lot in court with us, and hopefully we have a good decision when the decision comes out.
Derek, is it true that Canadian doctors can in fact open a private clinic as long as they're not part of the public healthcare system?
Now, Canada, the legislation throughout Canada is provincial. So Canada is a patchwork. Now, here in this province of Alberta, it's not the case, is my understanding. You have to, if you're going to open a surgical facility, it has to be government inspected and effectively government owned. In BC, that's not the case. Now, in Saskatchewan, things are different. And again, in other places across the country, like Newfoundland doesn't have any sorts of these restrictions. And in Quebec doesn't have any ban on private insurance. Saskatchewan doesn't have a ban on private insurance. So you really have to look province by province. But the fact is, in BC, private healthcare is perfectly legal. There is a dual practice, there's I guess, two-tiered medicine in BC. That's the way it works. But the problem, again, is that patients can't buy insurance, so they have to pay out of pocket for all the expenses of the medical care they receive. And at the same time, doctors must either be in the public or the private system. They can't be in both. And so those two things together effectively create these long waiting lists in BC. And that's problematic because government actually does ration care. So there's much evidence of this at trial. And one good example is bariatric surgery. So bariatric surgery, the wait lists in BC in a number of years ago were around 500 people waiting on an annual basis for bariatric surgery. And the government capped surgical procedures at 50 per year, which meant that if you were number 51 on the list, you were waiting until next year. If you were number 300 on the list, you were waiting for years. Now, what happens is when you're waiting for surgery, you're in pain. It might be knee surgery or hip surgery. You might miss the best period of your children's lives. You might not be able to play with them because of your health condition. You might be risking further problems with your health, like one of our clients in the Canby case who suffered irreparable spinal damage and became paralyzed. Or you could risk death, as another one of our patients who fortunately did not die, but she was able to seek timely medical services through a private facility in BC. So these are real problems. There are real people that are suffering and in pain in BC on these waiting lists. And as a famous Canadian case said, the Shwooly decision out of Quebec over 10 years ago said, access to a waiting list is not access to healthcare. And it's a very important distinction. Just because the government has surgical facilities and can do the surgical procedures for you in their facility doesn't necessarily mean you're going to get it in a timely and effective way that will preserve your health. And if your health is at risk and you're suffering, it becomes a constitutional violation when the government doesn't allow you to solve your own medical problems.
Like you mentioned earlier as well, not allowing a combination of private and public health care, many Canadians are going to say, we don't want to be like the United States, right? Two-tiered healthcare system. But if we're talking about a similar system to what countries like Germany, Sweden, and the UK are using, why are we opposed to something that has a great track record?
Well, that's a very good question. I'm never really sure why we always compare ourselves to the U.S. other than they're geographically close to us. It seems to be somewhat of a bogeyman, and I would like to see us compare ourselves more to France or the UK, Sweden, the European countries that actually have been functioning very well with a public and a private system in tandem. We shouldn't just be stuck into this mindset that we just have one healthcare system for all, we all have to be in it. And in my opinion, that's what's led to our poor results when you see our healthcare system ranked in the OECD studies. We're always near the bottom of the OECD countries in ranking of healthcare outcomes. And I believe that's at least partially because we haven't allowed doctors and patients to come together to solve problems. And if the government would simply get out of the way in cases like this, patients would be able to work with their doctors and develop solutions to the medical issues that they're facing.
I understand that the nurses union argues that private health care causes doctors to double bill. Is that true?
Well, that is actually a subject of some consternation because in BC, what they define double billing as is something very different from what it sounds like it should be. Now, when I say double billing to one of my friends on the street, they would think, well, the doctor is billing the government and billing the patient simultaneously. But BC law doesn't necessarily view it that way. The BC law views it as if you bill the patient for it, and you could have billed the government, regardless of if you do or not, that is double billing. And so that is a matter of some interpretation, let's put it that way. And in fact, that's what started this Cambie litigation off in the first place, because way back in 2009, the nurses union in BC actually sued the government of BC, saying, look, there's private facilities in this province that are double billing. Now, it was never proved in court what that was or what definition should be used. But when Cambie then became implicated by this lawsuit against the BC government, Dr. Brian Day, the owner of Cambie, then turned around and had to start his constitutional challenge to maintain his clinic. Because what was going to happen is potentially he could be shut down. So that was really the start of this litigation back in 2009. And so whether or not that's true hasn't been proven in court, and I don't really know what to say about that at this point.
Now, is it true that BC actually places a cap on the number of surgeries that can be done? And if so, why? Would that not limit the ability to make use of available facilities and doctors?
Absolutely, and every province does this. This is like how sausage is made in the healthcare system. When at the beginning of the year, governments have a budget and they say we're able to spend X number of dollars on healthcare, and then as it goes through the process of deciding how that money is to be spent, what ends up happening is certain numbers of procedures are determined to be affordable under that budget. And so when I talked about bariatric surgery before, that's a perfect example. There's 50 bariatric procedures that were able to be done in BC in, I'm going to say 2015. I think that was the date. And before that, it was a higher number, but budgetary restrictions came in and it was reduced to 15. And so what happens to those surgical facilities when the budgets are reduced? Well, they sit empty. Doctors might twiddle their thumbs. They're looking for work. And the fact is that the facilities are there, the people are there to perform it, but the money isn't. And that's the government's budgetary decisions that are rationing, are saying upfront how many procedures can be performed per year. And that happens across the country. And in this case, when we're talking about BC, it's the BC facts that are important. And in BC, yes, that absolutely does happen. And so what ends up happening is that creates waiting lists. And so if you're on the list, but you're not scheduled to be done this year because there's not enough money in the government's budget, then you have to wait till next year or the following year to get your procedure. Meanwhile, you're in pain, you're watching your health deteriorate, and you're maybe even risking death. And this is a problem because you're not allowed to buy private insurance in BC. You cannot jump the queue, as it were, and get private insurance and go to a private facility. You would have to pay completely 100% out of pocket. And in our opinion, that's not fair. That's not equitable. That punishes people who don't have the means to do that.
Derek, some people say the government should make it illegal to travel to another country for surgery, even life-saving surgery. Just get in line with everybody else. How do you respond to that?
Well, that would just make the problems that we're having worse, wouldn't it? Now, everyone has to suffer. It's just a fact of life. There's only so much money that can be put into private healthcare. The government either will have to tax us a lot more, or will have to find enormous efficiencies in the system to get rid of the wait lists. It's funny. There's a study released by C.D. Howe a number of years ago that kind of showed what's on the horizon for Canada as our population ages, as healthcare becomes more expensive. Already in provinces like BC, Alberta included, healthcare is right around the 50% of the provincial budget, and that is slated to increase enormously in coming years. This is a wall of reality that we're coming up against. We simply cannot afford to keep things functioning the way they are now. We need to find new ways to deliver healthcare. We need to find efficiencies. And one of the best ways to do that is to allow patients and doctors to come together to solve problems on their own. Allow people to buy private insurance. Come up with new ways of allowing doctors to practice in public and private simultaneously. It could be as simple as saying, if you want to perform surgeries in the private sector, you have to put in 50 surgeries in the public sector. It could be something simple like that. We just need to unleash this, unleash the market on this, because right now people are suffering and dying. And as the Supreme Court said in Truly, access to a wait list is not access to healthcare. It can't be more clear than that.
Derek Fromm, staff lawyer with the Canadian Constitutional Foundation. Thanks a lot for joining me today from Chestermere Lake, Alberta.
Thank you.
On behalf of all of us here at BCN, I'm Hal Roberts. God bless, and thanks so much for watching.